Hundreds of thousands worldwide have been affected by COVID-19, but measures are continuing to be put into place to help flatten the curve, and that includes social distancing. A new vocabulary for a lot of us, right? To help us understand what these terms mean, we check in with the Valley Today's Abby Furchner, who joins us live in Studio B, and it sounds like you talked to the experts to kind of help us all understand what's happening.
Yeah, good morning, Lisa. I know it definitely can be a lot, but I want to start with the curve. And so the curve is used to see how an outbreak is affecting an area. And you might have seen two different curves like this one. So if a curve is spiked like this and then drops off quickly, that means many were affected at one time. And then there's also this other thing called the bell curve, or to flatten the curve. And that's what many health officials are wanting to happen in America.
The idea behind flattening the curve is that you want to try to spread out that illness over a longer period of time so that you don't overwhelm the system with a whole bunch of sick people at one time. So the incidence or the number of people that get ill over a time might still remain the same, but you spread it out over a longer period of time. So instead of it being, let's say, within a couple weeks, it might be within a couple months.
The curve can also determine how well we're doing with our public health, like properly washing our hands and taking social distancing seriously. And social distancing is so important at this time because it limits our exposure to those respiratory illnesses. And who can you be around? I know one-on-one, 6 feet away, that is definitely the recommendation right now when it comes to social distancing. But also think of your inner circle, the people you interact with the most, your immediate family. Dr. Vetter says you can be around those people at this time. But if those friends are kind of going to other social gatherings and going to the grocery store back and forth, you might want to limit your exposure to them. So I know it's a lot to understand, but these are two very important things to keep in mind during this time.
Our new normal, a lot of changes. Abby Furchner reporting live for us this morning. Thank you so much.